opportunity. I live in South Euclid. I also observed in Ohio. The Caps Amendment that became part of the Health and Energy Committee healthcare bill specifically provides for coverage of abortion, both taxpayer funds and private coverage of abortion. You said it yourself, just because you're poor doesn't mean you shouldn't be able to live. I'm going to phrase after that, but that is essentially what you said. I wanted to ask you whether you would here and now agree with the majority of your constituents who in polls have said that they reject taxpayer-funded abortions. Will you reject that and instead work with us to set up pregnancy health centers and assistance for women who are being abused and pushed into abortion by people who don't want the abortion yourself? Will you do that?
First, let me say to you that really isn't quite accurate. The law, the current law, says that abortion can only be paid for with public dollars in the case of rape or incest or the, thank you. That's the current law. The law hasn't changed.
The Caps Amendment provides an exception for that Hyde Amendment, though. It says that.
But that is not a part of the law.
But it is proposed as part of the health care bill.
It is proposed.
That it supersedes a Hyde Amendment. This is why I think we have to have a specific exclusion for taxpayer-funded abortions so that we don't have our taxpayer dollars, which are so scarce and are needed in so many ways. You know, we need to exclude them from abortion and not just answer the problems of poverty with abortion.
But the other thing is, first off, let me say this. The other thing is everybody who's going to be in the public option is not going to be on taxpayer dollars. That's the first thing. And that's the mistake people make. Just because I will probably end up being on the public plan, and I pay a whole lot of money for insurance every month. But I do hear what you're saying. Right now, I am going with what the law is. I'm going to follow the law. I need to find out more information about it before I make a decision about it. But I would say to you this. I understand your point, but I also understand, again, that just because you are poor doesn't mean you shouldn't have the same services as people who are not poor.